Hi, my name is Amanda and I am discussing mesothelioma treatment options for those who have acquired mesothelioma cancer or mesothelioma-related diseases. If you are like most individuals who have been diagnosed with mesothelioma, you will want to determine what your treatment options are and you will want to know that information quickly. This article will point out some of the most common mesothelioma treatments so that you will be able to make informed decisions. One of the main mesothelioma treatment options that you will have will be chemotherapy. This means that you will be administered drugs that will help kill cancer cells. The specific types of chemotherapy drugs depend on the physician's assessment of your cancer and their recommendation. Chemotherapy is one of the most common treatments that many individuals will have when they have been diagnosed with mesothelioma cancer. However, you should realize that there can be a lot of negative side effects related to this cancer treatment and it is generally not a cure. Therefore, these side effects should be discussed with your doctor. Depending on the condition of the patient, chemotherapy is quite regularly used to achieve different goals. Often this will depend on the stage of the cancer at the time of detection. Often, the chemotherapy will be administered if surgery is not an option. Another choice in regards to mesothelioma treatment options is radiation. This is when high-energy streams or beams of radiation are sent into the body in order to kill the cancer cells. Many of us have been exposed to radiation in the form of an X-ray. The radiation used in cancer treatment is a much larger dose to destroy the cancer cells. Again, even though this is often a very popular treatment approach, it can have some very negative side effects on the patient, so you should always discuss these with your doctor before you make any decisions. Sometimes radiation is used in conjunction with chemotherapy. In some cases, you may be able to have the cancer removed from your body surgically. This is not an option that can be considered in all cases, but in some cases it can be very effective. If you think that this option may be a benefit for you, you should consult your physician about this. Gene therapy uses a strategy that attacks the disease by adjusting the manifestation of a person's genetics toward a therapeutic objective. The assumption of gene therapy treatment is centered on repairing disease at the DNA level and compensating for the irregular genes. There are two types of therapy known as replacement gene therapy and knockout gene therapy. These two types of mesothelioma treatment options offer hope in the future for mesothelioma cancer patients. Replacement gene therapy switches a mutated or absent gene with a normal copy of that gene, which serves to keep cell growth and division under control. The infamous p53 gene, the most common gene mutated in cancer. This gene has become a leading target for gene substitution and has met with some good results in suppressing abnormal cell growth. In regards to knockout gene therapy, it targets the products of oncogenes. Oncogenes are genes that can induce tumor formation in an effort to suppress them and make them inactive to reduce cell growth. Immunotherapy or biological therapy is a relatively new form of treatment. The therapy attempts to make use of the human body's own immune system to safeguard against disease. Scientists have identified that the immune system could possibly be able to understand the variation involving healthy cells and cancer cells. Eventually, the hope is to eliminate bad cells, those that become cancerous. Immunotherapy is intended to fix or boost the immune system's natural anti-cancer functionality. Elements used in immunotherapy are called biological response modifiers, BRMs. These will alter the relationship involving the body's immune defenses and cancer, thus increasing the body's capability to battle diseases. Some specific biological response modifiers such as cytokines and antibodies occur naturally in the body. Today, it is now feasible to generate BRMs in the lab that can mimic or have an impact on natural immune response agents. The goal is to enhance the immune system and allow the immune system to attack and destroy cancer cells. This would include attempting to prevent the cancer from metastasizing to other organs. The BRMs are used in cancer treatment today and include interferon. Many BRMs are currently being used in cancer treatment, including cancer vaccines, interferons, and interleukins. Palliative care or treatment is a specific kind of treatment that relieves discomfort and other signs or symptoms. The primary objective of palliative medicine is not to extend life or accelerate dying, but alternatively, to maintain the person and make as comfortable as feasible. Sometimes you will hear the phrase pain management. Palliative care tries to help increase the quality of life for individuals with life-threatening health problems, like mesothelioma. For the affected individuals who are going through therapies, palliative care consists of symptom management and treatments aimed at re-establishing function. For those terminally ill, the care eventually evolves into the role of hospice. There are times when these mesothelioma treatment options can be combined in order to give you the best outcomes when it comes to helping you eliminate the cancer in your body. It really does depend on the type of cancer that you're dealing with, where the cancer has spread to in your body, and how severe the cancer is. All of these things need to be discussed with a healthcare professional before you make any final decisions. Your doctor will be able to help you fully understand what may be the best option for you. They will also be able to speak with you about the side effects of all of the treatment options you have. Taking the time to discuss all of your options will help you make informed decisions that will be a benefit to your health.
Visit www.mesotheliomasbestosinfo.org for more information on mesothelioma and asbestos-related diseases.